Okay, please get your seat. We're going to start soon. Thanks for coming. Yeah. Okay, this was 2 years ago. You can get it from YouTube as well. So with that, I actually declare the start of Health Ecosystem Day 2025. Okay, thanks. Okay, so first and foremost, let me welcome Zoka, CEO of APAC and member of Group Executive Committee to give a welcome address. Eric.
Thanks, Jim, for the warm welcome. I hope everyone enjoyed the video. See that not much has changed, but at the same time, I see that some people have updated wardrobes, new socks. A lot of people, as they said, has aged agelessly, and it's good to see a lot of familiar faces here today. Thank you on behalf of the Zilke Committee. Now, each one of you represents different parts of the health ecosystem, from medtech to pharma to hospitals to public agencies, and today we also have some hyperscalers and also digital innovators. Today is one of those few days that we all get to collide together in this great melting pot to share these ideas and also the battle scars and challenges that we have across the industry. So the theme of today very much is around collaboration. So as some of you may know me, I really love analogies, right? And actually, I think healthcare is like a team sport. And not one single person can make changes in this ecosystem. Unfortunately, sometimes in the team sport, the referee is also the regulator in our space in health, and that sometimes becomes a challenge. So today, events like this help us align, so we can align our playbooks, so we can understand each other's roles, challenges, and I said battle scars, and really move the whole ecosystem together. Furthermore, I would like to extend a heartfelt thank you to a lot of our collaborators and also the speakers and panelists today. So we have quite an interesting number of different events coming up, and I think there's 3 different ones that you'll share some of the key topics in the industry. Now, we're also very much honored to have Dr. Chong Wei Yang here, sitting in the front row. He's delivering our opening keynote again. Many of you know him as a person that moves effortlessly across policy, research, innovation, and also strategy. But looking at all of the things that he's delivered, what really I admire in him is his range of experience that really shaped his career and his experiences. Dr. Chong played a pivotal role in shaping the national health innovation from Singapore's COVID response through to major research and technology programs. And he often speaks and creates about creating permission spaces. And I think that's really important in terms of the theme today around collaboration, because as I said, it's not one single person or one single company that can drive us forward. It's these permission spaces where we can speak openly and share together. So I think he really embodies the spirit of what we have today, and we're really honored to have him as our guest. So we'll bring together a number of different disciplines, perspectives, and strengths to really deliver better outcomes for our customers and for our people. So again, to our supporting partners from the Innovation Zone, thank you very much for your support. And we hope that your solutions demonstrate that healthcare isn't just a conceptual idea. It's really happening here and now, and hopefully we can really drive a lot of things from today's addresses. Now, Zukle is a global transformation partner. Some of you may not know us, some may not know how to say our name. From today on, you'll know how to say our name. It's Zukle. Also got a smiley face in the U, so we're service with a smile. So Zukle is a global transformation partner with engineering in our DNA. So we help our customers cross across the complex regulated environments, especially in health, finance, and also public sectors. So we work across strategy, technology, delivery, and operational excellence. So we support together to face challenges around clarity, creativity, and confidence to move things forward. A little bit about the company. So we're founded in 1968, so no spring chicken. We've been around for a little while. We're a privately owned company across 17 offices in 10 countries. Now, we're ISO certified across all these different areas, which means very much so that we reflect our commitment across security, safety, quality, and also especially across regulated environments such as health and medical devices. So we're also in the 17 offices in 10 countries that we're in. We're headquartered here in Singapore, but that gives us quite a front row seat to understand what's happening in terms of innovation and deliver the best things across health and innovation for our customers. Now, here's a view of a lot of our different customers. You may recognize some. A lot of you are from these companies as well. We're working again across hospitals, medtechs, public agencies, and digital innovators. In Singapore specifically, I see some familiar faces from Obey, Boston Scientific, SingHealth, Singapore ETH Center. They've all been critical, and you'll find them in the innovation zones around the lunchtime. So do feel free to meet them and explore their work. Now, in closing, at our core, what Zukle does is we help customers rewire their business for future. So across digital health platforms, modernization innovatives, innovation pipelines, or new capabilities that improve this. So again, if you'd like to learn anything more, please reach out to my team. If my team could just quickly stand up so you can see who they are. They're either wearing a pin or in the t-shirts. So there's quite a few of us around today. They're very friendly. I hope they don't bite. They're fine. So enjoy the session today. Now, just in closing for the conference, it's a reminder in my opening address that once again, no single person, no single organization, or no single company can really drive us forward. But together we can drive creativity, courage, and commitment. So in terms of the sporting analogy, if you use sports as the analogy again, this is our training grounds where we can really share the ideas across the different leagues that we have to really find commonalities across the board. So thanks again for joining us, and hope you enjoy the second Health Ecosystem Day. And thank you very much for your time.
Thank you, Eric. Okay, so I guess some of the people here may be new to Zoka, first time coming to our event or listening about us, right? So feel free to reach out to all the Zokis over here, and then they can share more with you. And of course, there's also booth and screens that you can see what Zoka has done as well. Yeah. So very quickly, I'll do the opening address and also a key highlights of some of the health ecosystem paper points that we talked about from 2 years ago. Yeah. So first of all, many people ask me, right, why do we do a health ecosystem day? What's so special about this? And how is it different from many other health ecosystem days, right? So, I mean, I always like to share the story, and I have 30 seconds to share this story today, right? First of all, 2 years ago, when I talked to different customers across the medtech, pharma, hospitals, right? Many of us tell me that, oh, hardly they get together. The relationship is purely a vendor-client relationship, right? First of all. And secondly is that, I don't know if they are here, but one of the pharma clients actually told me that every time they talk to a hospital, I know there are many hospitals providers here. Every time they talk to a hospital, before they even talk about what they want to do, they say, can you pay a $1 million fee? Okay, so that was quite a disappointing thing to many of them. And I realized that there's a lot of misperception and misunderstanding about each other. And of course, we have many innovative solutions in our innovation zone today, right? And every time I go to a hackathon, the first thing I hear is, I'm here to disrupt the traditional industry because they are doing very badly, okay? So I don't think it's all about disruption, right? There's a lot of collaboration potential as well. Right? Sorry, I'm speaking like this because I just had my wisdom tooth extraction last week. Sorry for that, right? Somebody feel that I speak very strangely. Okay, but anyway, yeah. So, and then when we attended many conferences, it's either a medtech only conference or pharma only conference or hospital only conference. There's hardly one that brings everybody together. But of course, I see Richard from Economist here. The recent one they did recently is really trying to bring people together as well. Okay, then we actually started this 2 years ago, and we reached out to all the potential different industry people, right? And then they kind of say that it's a good idea. Let's do it together. And we did it 2 years ago, and it proven to be quite successful, right? We have 170 people registered and 150 people turn up. So I think it was very good. And I hope that you really enjoy it if you were here 2 years ago. Yeah. Okay, so fast forwarding to 2 years later, right? We already tried to bring everybody together. Did we see any success, right? So the answer is actually yes, because I don't know if Dario from Agnima Health is here, right? There's Dario is here, right? I mean, Dario is going to have a booth later on as well. It's a SingHealth spin-off, right? That's collaboration between SingHealth and Roche Pharma, right? And there are more cases that you can see from many of the innovation zones player here. So I'll say that the success is already proven. But of course, we have experienced some of the not so successful ones as well. And that's where the discussion later is going to bring you what are the lessons learned for those that are not so successful. Okay. So quickly going through the agenda so that you know how it's going to flow like for today, right? So we start from 11, right? Eric and myself did the opening and welcome. And then we have Wei Yang going to share as the opening keynote, right? And then we will have 3 presenters as well, right? You can see the flow is actually ranging from Singapore, where Wei Yang and Chen Hui is going to share about Singapore perspective of a health ecosystem. Then we move to Bernish from APAC Med, who is going to share from a regional perspective. And last but not least, I don't see Mike. Mike is over there, right? Mike from Korea, he just landed last night, right? He's going to share from a global perspective. So health ecosystem is not just a Singapore thing, right? It actually moved to a regional as well as global collaboration, right? So definitely you will hear a lot from their sharing. And of course, we'll move on to lunch, about 1.5 hours, right? Nice lunch at the lunch area. And that's where, if you have not visited the innovation zone this morning, please take a look at that, right? We have 3 sections for the innovation zone. One at the lunch area where you have SingHealth, Singapore ETH Center, Microsoft, AWS, Zebra, and Excel over there. Then you have 2 here, Gene Solution from Vietnam, and Health on Cloud and Smart Hospital Alliance from Korea. Then at the lounge area, which is to my left, you have NUS School of Medicine, 9 companies over there showing very innovative solutions. So I know there are investors here, there are players here. Feel free to look for your potential collaborators as well. Yeah? And then after lunch, we'll have 3 panel discussion, right? First one is about AI, not surprisingly, right? When I say let's do panel, everybody say, are we going to say AI? In fact, many people don't want to talk about AI, but we have to do it because it's one of the key topics in today's world, right? Then we'll move on to more about value-based care. And last one is about scaling innovations in the health ecosystem, right? So I hope you will enjoy today's agenda. It's going to be very packed, right? So we are keeping up to the time as well. Okay, so before I invite the keynote speakers up on stage, let me quickly share some key highlights of our white paper. And feel free to download it later. There's a QR code, yeah? So 2 years ago when we did the Health Ecosystem Day, right? So we kind of gather the inputs from many people, right? And we also gather many research data. So I'm not going to show you the data and the graphs here, right? You can download the white paper and you can read about that. But we actually share it from an APAC perspective, how ecosystem is evolving in APAC. And actually, it's not just APAC. Our European colleagues actually downloaded it and find it very useful as well because APAC is so diverse, right? So different countries in Europe can actually have good lessons learned from the APAC, the diversified APAC countries itself, right? Status of play in the APAC, not surprisingly, aging population. But one thing to note, we have the steepest gradient, right? We are aging much faster than many other countries, right? Digitalization, I think we all know that APAC is leading in a lot of digital transformation and digitalization. So that's something that APAC is proud to be of, right? And of course, increasing burden and shrinking workforce is not new to APAC, but of course, with aging population and digitalization, all these things are putting more to it as well, right? And we are 60% of the world population, probably is increasing more as well, right? Definitely, we contribute to the entire health ecosystem changes. Okay, so some of the challenges, right? While we are growing influencing in the global healthcare, right, the systems remain fragmented, not because of different countries only. Even, sorry to say that, within certain countries, right, even the systems are fragmented. Of course, Singapore is leading a way that we are consolidating many things from a one EMR, one pharmacy system, and many other things. So when I talk to actually some of the CIO in Switzerland Hospital, they actually want to learn from Singapore experience as well. So that's something good, right? So challenges, the trust, right? Who is actually able to share data. Today we have Sylvan, my colleague. Sylvan is here. So he leads our AI and data. Feel free to talk to him because he's doing a lot of centralized data platform and AI use cases on that, right? So that's something we can share as well. Okay, then scalability, which we'll have a panel discussion on that, complexity and unpredictability. So these are the challenges, not just in APAC, but globally as well. And APAC has many of this due to the very diversified and fragmented systems. And health ecosystem player, many people think health ecosystem is just hospital, pharma, and medtech, but actually it's beyond that. We look at health ecosystem as this circle that you can see, right? That's why today's event is not just medtech, pharma, and hospital players. You see payers from insurance company, you see investor, you see hyperscaler, you see innovative solutions, and you see research institution. We have quite a number of people from A-Star as well, right? So there's something that I think we are bringing the ecosystem together so that we can explore collaboration together. Okay, and thanks to, I don't see Kenneth, Eric can't come today, but thanks to Kenneth and Eric, right, they actually, from the health ecosystem, also support that APAC is actually leading in a lot of digitalization, and this is one of the key changes, whether it's a data platform or is it digital health applications, that is actually going to lead and solve many of the challenges that we see, right, in ecosystem collaboration. Okay, this is the anecdote, but it's just a flowchart. In this highlight, you can download the white paper and you'll see the detailed description and actions and the suggested solutions for each of these bubbles here, right? So how can we nurture an ecosystem innovation, right? Definitely you need to have a valid business case because a lot of innovation start for the sake of innovating, right? But do you really have good ROI and scalability from there is something that we can discuss. Next thing is innovation-ready organization, especially innovation within let's say, a public cluster or within a medtech companies, is always not easy, right? If you don't have the usual thing that we talk about, people and processes, having technology alone would not be good enough. Okay, and last but not least, apart from data-driven, is patient-centric, right? Health tech or medtech is something very special and quite different from many other startups or innovative solutions, right? I'm not saying or putting down on, let's say, fintech or other things, but when I venture into the healthcare industry 8 years ago, first thing that people tell me or my clients tell me is that I want people who actually care about the patient to work in the healthcare industry, because everything that you do may touches the patient's life, and any mistake you do is going to affect people's life. So it's not just another startup, another innovative solutions. So there's something special about the healthcare industry. Okay, and we have Wei Yang here as well. So thanks for your quote, right? If you still remember the quote you gave 2 years ago, right? So definitely we need to ensure there's incentive, right? Because everybody also have their KPI and ROIs, right? They are looking for. So to form an ecosystem collaboration, there must be things that can incentivize every players in the ecosystem as well. Then we have Emmett, who cannot be here, but I think his representative, Ying, will be here in the afternoon, right, from Roche Pharma. Right, he also thinks that the technologies can play a part, but at the end of the day, it has to be bringing the people together in an ecosystem play. Okay. So creating a successful ecosystem needs to align interests and incentive across different players. Okay, and of course the benefits, right? As I already mentioned, we see some of the benefits already happening over the past 2 years, right? Sustainable innovation, right? Share costs, share successes, and of course, connected care across the entire care continuum itself. Okay. So this is the white paper. Feel free to scan the QR code. You can download it. Then you will be able to get more information out from that white paper itself. Okay. Okay, good. Siri or Gemini or DeepSeek is eavesdropping me. Okay, don't know which one now. Okay, so we'll flash this slide again during lunchtime, right? Feel free to download it. So now, without further ado, let me invite our opening keynote speaker again on stage, Dr. Cheong Wei Yang. Thanks for being the second time the opening keynote speaker, right? So he's going to talk about redefining healthcare, lessons learned from Singapore on sustainability, innovation, and value-based care. And Wei Yang is the Vice Provost of SMU. You are also the Senior Advisor on Health Economics for Ministry of Health. And of course, you have many, many other titles. I know Wei Yang since 2007 when he was the Deputy CEO of NRF. Right, so feel free to catch him later, and we'll welcome Wei Yang on stage.
Hi, good morning, everyone. Good to see many familiar faces among the crowd here. I think we're still in the process of building up the ecosystem. But again, as we build an ecosystem and we build a connected group of people, I think what is also important is that we continue to make sure that we are aiming at the right place. I think last time round, I spoke about alignment of incentives, ensuring that we are all able to sit around a table together in a certain relationship of trust. I'm economist by training, so I talk about repeated games. The idea that if we are in it together for the long haul, then there's reason for us to work together, give in to each other from time to time, so that we'll all gain a larger pie in the process. Okay, so that's of course in the first talk I was giving it from a perspective of just the health ecosystem. Okay, today I'm going to talk a little bit more about. Oh, sorry. The slide says, okay, sorry. Okay, right, thanks. Yeah. So when I got this topic about redefining healthcare, there's something else to do. So when I first got the topic of redefining healthcare, I started thinking a little bit more about some of the work that I'm also doing in Singapore Management University right now. And of course, one of the things that, as we started thinking about healthcare and sustainable health, it became clear that as we think about that, with the aging population and the aging demographic across Singapore and perhaps across the rest of Asia, we need to rethink how we think about sustainability. Okay, so that's one thing I would then talk about. And of course, if we rethink what we think about as sustainability, that will shape how we think about innovation, that will shape how we think about value. So just to set some context of what do I mean. I think Jim mentioned that one of the key things that all of us identified was demographic change. The aging society also means less workers, right? The combination of which is that people keep talking about dependency ratio. Singapore, we're very worried about it, but what you may not be aware is that actually the problem doesn't just affect Singapore. It affects all the Asian cities, and some of them actually have it worse than Singapore. The last official figure for Bangkok was 0.78 for the TFR. I think the latest unofficial figures is 0.7 or even less. And of course, for many of the countries, or at least for many of the cities in Asia, because they actually experience a large amount of rural-urban migration as well, which thankfully in Singapore we don't have to deal with. What happens is that people come into the city, get educated, hold down a job, start to earn a healthy pay, and then decide to bring their parents in from the village, and then lock them in a cell in the city. Because they put them in an apartment with no social linkages, with no ability to navigate the city, and yet somehow we are expected to have a sustainable healthcare system and a care system for these people. Okay, so just to put some of these things in your mind to understand what is the nature of the problem that we are dealing with. Of course, in Singapore, we know that we have an aging population. We have traditionally lived in apartments. Many of our elderly now maybe stay on their own without their children living with them. We do have an issue on our hands in Singapore as well when we want to think about solving the issue of sustainable health, sustainable care, right? But what I want to propose is that whatever we do to solve the problem for Singapore is also a solution that many Asian cities will sorely need, if not immediately, then at least within the next 10 years or so. Okay, so that's the first motivation factor I want to put in your mind. But of course, as we then think about sustainability in healthcare, I think health tech is where I think most of you are right now, and actually already trying to connect between the digital systems, the medical technologies, diagnostic systems, the therapeutic system, and trying to link that together. I think it's already a very important element of the work that you try to do. I'll talk more about that later because obviously that's where this community is targeted at. But I wanted to also highlight that if we really want to achieve sustainability in healthcare in the face of an aging population, we need to think beyond just health tech, to think about what I call care tech, which is how do I deliver care and an ongoing monitoring and an ongoing sort of like preventive stance even as people live in the community, okay? And I actually want to further add that it would be very important for us to think about how we actually build an ecosystem that keeps older people engaged, be it in volunteer in the society, micro jobs that they are able to take up, things that tap on the experience that they have built up over their career, 50 years of working life or 40 years, depending on how long you choose to work, so that because they are engaged mentally, they are physically also not going to degrade as quickly. Okay, so sustainability from my perspective, thinking of this issue, I think requires us to look more broadly than even the existing medical technologies ecosystem, health technology ecosystem, to think of sustainability from a much larger societal perspective, much larger economic perspective, right? Because if you look at this and try to tie this all together, what it means is basically the elderly have income of some sort, they actually have lower cost of care, and they actually have less instances of health episodes that require expensive expenditure. Now, of course, you might wonder, does that mean that is there business for the medtech companies, for the therapies company? Let me assure you that because the populations are rapidly aging, there is still a lot of people who will need your therapy, right? There will still be a lot of people who need doctors to look after them. There will still be a lot of people who need nurses. It's just where do we direct these resources most optimally so that we can actually sustain ourselves as a human community. So I leave this idea in your head as something that I feel is important as you think about sustainability in healthcare, because within the technologies that you will be deploying from a healthcare perspective, there are actually a lot of possible users across the larger spectrum of what we're trying to maintain, which is the sustainability of an aging population. Of course, in that regard, I should do a bit of advertisement for SMU. We will be launching institute in due time on the future of longevity, societies, and economies. Okay, so that combines in a way this thinking, and welcome all of you to be coming and working with us and figuring out how to measure the impact of all these various interventions that we do, but not to look at it only from a healthcare perspective, but from a larger longevity perspective. And how maybe, as part of that system, the data exchange and the ability to measure impact of the various interventions actually allow us as a system to invest a lot more into many of these care technologies. The digital architecture that would be necessary in order for us to share data across healthcare, to care sectors, to even employment sectors. I've been talking to some of the insurance companies and saying, how do I link some of these things together in a way that does not make individuals worried about sharing their data, but yet helping us to improve their outcomes overall. Outcomes for themselves as individuals, outcomes for the employers, outcomes for the insurance companies. So there are a lot of things that we could talk about there. But going back now to a more central health issue, which is where I think many of you are actually still targeting. I may have, some of you may have seen this before, but one of the things that I like to talk about, given my time in MOH, is that when I first entered MOH, we had the 3 Beyonds already. So I claim no credit for the 3 Beyonds, where we said that we wanted to move beyond the hospital to the community, which is a lot more from healthcare to, sick care to sort of like a health related work. From beyond healthcare to health, same concept. And finally, of course, beyond quality to value. So a lot more value-based care, a lot more sort of like understanding, yes, maybe there is a clinical cure, but maybe it's not cost effective. So what is a better alternative? What's a better way of doing it? But I think as we develop these ideas, we realize that beyond healthcare to health means that I need to start thinking about how do I even know, how do I maintain that health? What is deteriorating, what is not? So there are 3 Ps in health that we are now pursuing as a country, starting with population health, right from the bottom as the base. All of you have heard of Healthier SG, right? Healthier SG is about ensuring that everyone who is 60 and above, regardless of whether you have any known illnesses, are invited to come in for a medical checkup. Anyone who is 40 and above with known chronic disease is also invited to come in for a free medical checkup. That helps us to form a baseline data of the population in Singapore. Those of you who are in the medical clinical fields will know that levels of whatever you measure mean very little. It is deviations from the levels of each individual that often matter more than the actual levels you are measuring. The genetic makeup, the activities you do and so may naturally put your levels that you measure at a certain level. But if your levels are always that high, that I measure a high level, may not mean that you're in trouble. Right? But if you are traditionally a low level and then you get a sudden spike, that spike is actually the most important information. If I didn't have a baseline, I don't know what that variation looks like. Right? So population health in a way is one way of trying to gather that baseline of information. And of course, what we then have to worry about is data architecture, the technical standards and governance, even a more digital AI native care and clinical protocol for community delivery as we actually roll out a much more population health delivery system. And of course, with a population health approach, we have to worry about integrated care across providers. How do I make sure data travels from one provider to the other? How do I then make sure that there is accountable care across time? Right? So it's about integrated care, accountable care. Actually, it's a terminology that NHG group uses, so I borrowed it from them. Then, as we gather this data, what is useful about the fact that we have all the GPs participating is that all the GPs have slightly different experiences as they sort of like, learn their medical trade. under different mentors, different approaches. We actually have a natural RCT that's happening across the board as well in our population. When someone with a chronic disease shows up, different doctors might do slightly different interventions, slightly different approaches, slightly different amounts of data tracking and so on. And with that difference in approaches, there will be difference in outcomes as well, depending on the genomic makeup of the individual, his physical activities, and maybe his previous medical episodes. As that data gets collected over a population of 3.5 million people, we begin to have a basis of precision health. Precision health that's based on Asian-centric omics, because the population in Singapore, if you think about it, Chinese, northern, sort of like Asia, Northeast Asia, Malay, which is actually, and even South Indian, which is then what I call Polynesian, that these are the people who learn how to sail in catamarans from all the way from the South Pacific up to Japan and down to the Indian and the Indian sort of like the islands. And then we have the North Indians as well in Singapore, which is then representative of the Central Asian, Persian type of genetics. So within Singapore, we have a spread of genetics that probably covers most of Asia, 75%, 50 to 75% easily, right? So studying our data helps us to derive insights that could be applicable across the population in Asia Pacific as well. Within that, the question is then, is there a way for us to look through that data and have a way of stratifying that population? Stratifying the population may be then a part of a companion diagnostic strategy, right? Each therapeutic that I try, it works better on some than on others. I go to the sort of like the cost-effective health tech agencies. They will say not cost-effective because it's only 50%. But if I can stratify the population such that it works for 75% of the population, all of a sudden it might become cost-effective, right? So the ability to have the data to help you to stratify the population for which you want to indicate your therapeutic for actually allows you to become much more cost-effective, allow you to become subsidized, allow you to scale your therapeutic much better than what you're able to do on your own. So, but of course, with that, you may then, as a company, have to subject yourself to the idea, yes, I will allow for post-market surveillance because I want that post-market surveillance to further stratify the indication so that my therapeutic can be more effective. Okay, so there is a mindset change that you might need to think about as we do this. Finally, of course, as we do all these things, the holy grail, of course, in health is about preventive health. Right? It is to say that as I understand the characteristics of the people, the type of therapeutics that work, the kind of disease progression that occurs for some of the people because of the nature of their genetic makeup and so on, you end up in a situation where you may decide to use that to set out a strategy for when and who do you test and how often do you test. Right? Someone who progresses badly to disease, you may want to test more often. Someone who doesn't progress so easily, or at least even if they get a disease, the onset is mild and so on, you may test, let's say, once every 3 years. That is the basis also of a cost-effective, preventive strategy that allows any diagnostic tool to actually see market scaling. Because you can go to any clinician or any payer to say, I've got a diagnostic, they'll tell you it just adds cost. Until clinical processes change, until you figure out how to stratify the population, you are not saving money for the system. Okay, so of course, as we look at a much more digitally connected population, there is also a role for digital biomarkers to be measured, as well as the digital systems to actually provide behavioral nudges as well. Okay, so there is the traditional stratification of the diagnostics. There is also then the digital biomarkers, the behavioral nudges that may then affect those digital biomarkers that could be the basis for insurance adjustments. And of course, as we do that, we have to be conscious of what the ethics might have to say about this. Okay, so I give you a bit of a larger scale scan of actually what you might want to think about as you try to build out this ecosystem. And of course, maybe just a larger chart, you can take a picture of it. I'm not going to go through the entire thing, but really to then say that there is the therapeutics, the diagnostics, the digital systems, and even the robotic systems that I think but it's part of what Jim and the Zuke team is trying to pull together, all of which are part of a larger solution of what I was talking about just now, right? And it goes all the way to, if I'm going to push out care in the community, if I'm going to make flexible employment part of what I try to deliver, can we imagine a world where AI and robots work alongside humans, learn the skills that the human learns, and over time actually is just supervised by the human because the human begins to lose cognitive and physical capabilities as they age. Okay, so anyway, those are some things. Of course, there are also the role of robots in terms of actual healthcare, or maybe just elevating the physical task of the older people so that they actually put themselves in less jeopardy of falls and all these other things that might otherwise, come along with it as well. But I wanted you to then maybe pay a bit of attention to the enablers of how this innovation for value-based care is actually likely going to be brought about. You need to think about the personal responsibility part because that means lower costs for the system. You need to think about the data backbone, which is where Zuki might come in, but it's about the connected sort of like parts of the ecosystem. But how do you ensure that it is privacy preserving as well as confidentiality preserving and even cyber secure? And of course, we may then have to think about both the healthcare workers configuration, how we organize them, as well as our pricing related issues. And finally, of course, this idea that industry and international partnerships will have to be part of how we think about the solutions. And finally, of course, as you think about how you integrate this, so this is actually what I was going to talk about. Think about all these issues. Because data architecture is of paramount importance. A lot of companies I speak to say that they want to do this, do that with all the data that they gather. At some point in time, they overstretch beyond, why are you the company who's going to do this? Is the question that people will start asking. Right? And sometimes you might be better off saying, yes, I'm not the company that's doing this. I am passing my data over to a trusted data ecosystem, maybe something that Zuki can help us to assemble. But with that data ecosystem has certain rules of engagement that allow everyone to achieve their objective and to monetize their value accordingly as well, based on who else is using their data for other purposes that they are doing, but used in a de-identified way so that there is no concern around data confidentiality and all the other things that go with it as well. And that's where Dario comes in with some of the technologies that they're developing in terms of how some of these things could be brought together so that whatever data you contribute and whatever data you use, there's a way for you to be paid for and actually pay for it. Right? So those are some things that I think we have to think about. So anyway, I'll leave you with these thoughts. I think those are all the slides. Okay, one final slide that I have. Purpose, right? We keep talking about purpose. So I just want to remind you that in all the things that we do, we are actually trying to achieve the UN sustainability goals. Population health is also about equitable access. How do we ensure that we deliver equitable access at a sustainable cost? Precision health is about the quality outcomes that we're trying to achieve. And finally, preventive health is about the sustainability of the cost of the health system that we are presiding over. Okay, that's well, and thanks.
Thank you, Wei Yang. Yeah, sure. I like this slide. I used to work with UN programs many years ago. Okay, so thanks, Wei Yang. Right. Without further ado, let me welcome the second speaker on stage. Sorry that we have to move slides. Okay, so may I welcome Qian Hui from EDB, right? She's going to talk to us about advancing healthcare innovation and manufacturing Singapore perspective. Because when I talked to Qian Hui about this, right, I was saying that people know Singapore as a research and innovation hub, right? Because we have a lot of good talents for that. But nobody actually think of Singapore as a manufacturing, especially for medtech or health ecosystem, because we have scarce land cost is expensive. People are not that cheap as well, right? So how can Singapore go from a research innovation into manufacturing, right? And recently we see Illumina increasing, hiring like 25% more people in Singapore. So I think Qian Hui will share with us very good perspective on that. Welcome, Qian Hui.
Hi everyone, I'm Tian Hui from Singapore EDB, and I lead the MedTech strategy development from EDB, as well as conduct market development for Singapore in terms of medical devices, diagnostics, and biopharma. Before this, I spent time at the Health Promotion Board, and I did a variety of roles across company outreach to national COVID testing, and also the latest one, NutriGrade policy, which you see on your beverages and menus out there. Yeah, so I've worked across different types of partnerships with the public healthcare ecosystem, our biopharma companies and medtech companies. So very happy to be here with you today among many familiar colleagues and partners. This year's themes around building sustainable ecosystems. Across the past 20 years that Singapore has been investing into building up our biomedical manufacturing and innovation space, there are many ways. Sorry. Thank you. Yes. Okay. Thank you. So much. Yeah, thanks a lot for pointing that out. Yeah, so as we were saying, this year's theme is around building sustainable ecosystems. And in the past 20 years, there are many ways in which we can define ecosystems being built up in Singapore. All of you here today are also part and parcel of making this Singapore ecosystem a conducive and supportable environment for companies operating here. So today I'll be sharing with you from an economic lens on how we've built up Singapore's as a key regional and global node for companies in the healthcare sector. So I'm sure that we recognize there is a large unmet healthcare need in APAC. Just looking at the figures, we're home to 3 in 5 of the world's population, but only share 1 in 5 of global healthcare spending. APAC is expected to be the fastest growing market over the next 5 years, contributing to $5 trillion or 40% of the global healthcare spending growth. Thus, there's untapped potential here in this region, which makes it attractive for companies to seize this value and unlock new transformative opportunities in healthcare. Singapore alone for businesses is never a singular market of interest, as we are simply too small. But our strength lies in us being in the heart of APAC, within a 7-hour flight radius from the whole of APAC's 3.8 billion population. And combined with the strong trade and logistics infrastructure, a pro-business, stable and neutral operating environment, we hold strengths in terms of being a gateway for Asia. Thus, our vision is to be a leading hub in Asia for companies to innovate, manufacture, and commercialize end-to-end solutions along the healthcare continuum. Healthcare companies have been leveraging Singapore as a global center for their business, innovation, and talent, and we're working with them to further pursue key growth opportunities in the industry that lies ahead of us. So this is the map of Singapore. I'm sure many of you have seen the map of Singapore before, but how many of you actually know how many healthcare companies are operating here currently? So we currently have more than 80 regional headquarters from world-leading companies, 30 R&D centers, and more than 90 manufacturing plants. Within our limited landscape space, we have actually deliberately built up ecosystems to co-locate complementary stakeholders proximate to each other and build multiplied growth. So starting from the west, you see the buildings outlined in blue. That's our Tuas Biomedical Park, where many of our global biomedical companies are having their manufacturing plants located, and is strategically located next to the Tuas Megaport for ease of access to sea freight. When we move to the areas in orange, that's where your Biopolis and Greater Science Park areas located, with corporate R&D labs, research institutes, and also your healthcare clusters located to facilitate healthcare collaborations. And in the central business district in pink, which is where we are right now, there are your corporate regional headquarters and also country offices of key companies that's co-located with your tech and finance industry in Singapore to facilitate the accelerated growth of health tech from Singapore. So let's start this journey from exploring our biomedical manufacturing sector. Starting with the biopharma sector, over the years, Singapore has developed manufacturing capabilities across diverse modalities. So starting with the 2000s, we started with small molecule APIs manufacturing, building up to biologics in the mid-decade. And towards the future, we're partnering with companies to build new modalities and also factories of the future. Most recently, this includes AstraZeneca's investment of a $2 billion manufacturing facility in Singapore that will be operational by 2029. And this is actually the company's first end-to-end antibody drug conjugate site globally that will be producing their next generation of cancer therapies. Last month as well, Sanofi's Modulus facility was ranked among Times Magazine's top inventions for 2025. And the company has chosen Singapore and France as their first two sites globally to have a modular manufacturing system, which changes your traditional biologics manufacturing from a single product in a facility at a time to a modular system that allows up to 4 different products to be manufactured simultaneously in a plug-and-play manner. Our medtech sector has also punched above our weight, serving as a hub to manufacture high-quality, high-value products for global demand. We broadly categorize the sector into 4 key pillars as shown here, and for each, some of the key market leaders are producing significant market shares of their key product lines from Singapore for global exports. So this includes your next generation sequencing instruments, mass spectrometry, cardiac implants, contact lenses, and also hearing aids. So we've quadrupled the manufacturing output for MedTech in Singapore over the last decade and tripled the value add, with Singapore's operations often being the top performing sites in companies' global network. Around 60 to 70% of the MedTech companies that manufacture here also co-locate their product and process development capabilities in Singapore as well, so as to reap synergies in having that end-to-end mandate from here. And this manufacturing ecosystem is supported by a strong supplier base and also a robust semiconductor ecosystem, which is crucial for the precision engineering and electronics know-how to manufacture high-quality medtech components. So just as a case study, Fong's Engineering is a Singapore contract manufacturer. And looking back 25 years ago, they are producing a variety of precision components for different sectors. Over the last few years, starting with the connection to Stryker, Fong's has built up capabilities of high-quality medical device manufacturing and is working towards expanding their R&D and manufacturing lines for Stryker's endoscopy products. This has also allowed Fong's to build up a track record in medtech and extend to work with other companies such as PerkinElmer and SciEx. Of course, this is just one example of the wider base of CDMOs and suppliers based in Singapore. We also have Quasar for energy-based devices, Advanced MedTech for precision engineering, and Mayban and Sunningdale for their precision plastics injection molding capabilities. So these CMs have built a diverse manufacturing network across APAC, the US, and Europe, and they support medtech companies to fulfill any local content manufacturing requirements while reaping the cost arbitrage and efficiency savings from their global operations. As we strengthen our manufacturing base, we are also actively growing our R&D ecosystem to support both product and process development from Singapore. So key to this is our 5-year National Research Innovation and Enterprise Strategy, or RRE for short. So this strategy is continuously reviewed and updated every 5 years to ensure that our plants and industries remain connected and economically competitive. So you see on the right, human health and potential is one of the 4 key strategic domains. And we're currently working with A*STAR and other parts of the research ecosystem to plan towards the next 5-year tranche for RRE 2030. So often when I meet global executives during our overseas trips, they appear surprised that Singapore can actually plan for 5-year cycles and even sustain that effort over decades and build on it over the years as well. Ahead of the AI boom in the last 2 years, Singapore was actually one of the first countries globally to invest in a national AI strategy starting from 2019. So last year, we launched the second tranche of this, investing $1 billion more into AI compute, talent, and infrastructure. This includes doubling down on talent development to triple the AI talent pool to 15,000 over the next 5 years. And this includes building up domain sectors of excellence, including in healthcare. We can also reap synergies in our digital and semiconductor ecosystems. Did you know that 50% of Southeast Asia's data center capacity is hosted in Singapore? And we have 22 wafer fabs that are producing 1 in 10 of global semiconductor chips. We're also aiming to build pillars of excellence in AI, and healthcare is one of the sectors with big data and an even bigger market need. So we have some of the healthcare companies here that have also been working with the digital and AI ecosystem stakeholders in Singapore over the years to also shape the talent and governance scene in Singapore as well. The tech sector says they have a tech stack. We are also working with our various industry partners and ecosystem partners like yourselves to build up an ecosystem stack for the next generation of data-driven healthcare R&D from Singapore. So this is supported by 5 key building blocks: access to clinical data, industry expertise, public-private R&D capabilities, R&D talent, and a vibrant healthcare innovation startup ecosystem. Much of this will be touched on later during the panels and also the innovation zone, so I'll leave it to you to hear directly from these partners. So through some of the building blocks that I mentioned, we have also enabled flexible partnership models for leading companies to conduct R&D from Singapore. So this includes in-house R&D labs. For example, Chugai Pharma Body Research has developed crovalimab from Singapore and also attained US FDA and China NMPA approval just last year. For immersed R&D centers, MSD's Translational Medicine Research Center has also had more than 50 partnerships with Singapore's research ecosystem for biomarker discovery and early drug development. There are also multiple joint R&D labs within the healthcare space. For example, NUS Agilent Hub, which translates research to clinical diagnostics. And Singapore is often seen as a node for accessing APAC's life science startups as well. And this has brought in companies to set up their open innovation platforms from here to serve APAC. JLabs, for example, have established their presence in Singapore since 2023. And within a year, they have successfully incubated more than 30 startups. And these originate from the region, not just Singapore. So we spoke quite a bit about multinationals. For the startups out here, Singapore has also built up an ecosystem of partners and financial opportunities to support your growth. This includes corporates, incubators, venture capitals, and strategic investors that have set up their base here to actively scout for promising startups in the region. Across our government-linked agencies, clinical and research institutes, we have also set up talent development schemes to build up STEM talent and entrepreneurs. For example, SG Innovate has their Helix Immersion program since 2023. And this provides 1 year on-the-job training to help biomedical professionals from academia and research gain industry experience in fast-growing commercial biotechs. So this helps our talent base not just be research-ready, but also industry-ready. So if some of the stories have inspired you to think of possibilities, how can you start? From EDB's end, we can help you in 3 main ways: providing information about Singapore's business landscape, connections to partners that can help you multiply your growth, and also, depending on activity, potentially supporting with incentives to grow your Singapore-based operations. So with that, I've reached the end of my sharing, and these are my contact details. Feel free to connect with me, and also we are happy to discuss during the networking session later as well. Thank you.
Thank you, Chen Hui. Okay, I'm sure there's a lot of information that you need to digest from Chen Hui and Wei Yang's slides, so feel free to engage them during lunchtime, right? And Wei Yang will be sharing in panel 2 as well in the afternoon, yeah? Okay, so next in line is Benish. So Benish from APAC Med, which Zoka is actually a member of APAC Med as well. And then alongside with many medtech companies that Chen Hui mentioned, we have people from Boston Scientific here, we have people from Leica here, we have people from TMRC in MSD here as well, right? And when I talk to Bernish about speaking here, then I say it's a larger ecosystem, right? Although you are APAC Med, right? It goes beyond just MedTech, and Bernish has gracefully agreed that we will cover not just MedTech companies where APAC Med is actually very active in, but also to the larger ecosystem itself. So welcome, Bernish.
Hello, everybody. Very good afternoon to all of you. I think I can say good afternoon now. It's noon. A big thank you firstly to Zulke for bringing us together on this Health Ecosystem Day. I'll just quickly introduce myself. I'm Bernish. I head the government affairs and policy work at APAC Med. I also look at some of the work we do around ESG. So for those of you who are not familiar, though I know we already got an introduction, it is the only regional trade association for medical devices and diagnostics, and I would say a broader definition of that, even digital innovators across the Asia-Pacific region. Today in my presentation, I will try to the best of my ability, it's a very big topic to actually cover, but I'll try to talk about how geopolitics, innovation, and partnerships are really reshaping the healthcare ecosystem for the region, and why ecosystem collaboration is very important, now more so than ever. And that also brings me to the next slide, which actually says, why now? I mean, we can talk about it anytime, but I think now is a very important time to talk about it. I'm sure all of you have heard the word tariffs more this year than you have ever in your lifetime. So I think that provides a little bit context to what I'm talking about. But at the same time, I would say we are in a health system stress test. Of course, the demand for healthcare is surging. And when we say that, it is complicated further by the rise of non-communicable diseases, aging population in a lot of economies across the region. So those things, of course, are there. And at the same time, we also have capacity pressures exacerbated by after COVID-19, but even more so now. When we look at the same time at the governments, the budgets that the governments have are also quite tight. And throw in the geopolitical uncertainty into it, which is the tariff volatility, trade fragmentation. All this eventually has an impact on patient access. And when we even talk about recent developments, if you talk about rare earth export restrictions, a lot of them are actually made involved in imaging, diagnostic equipments, when we even talk about pharmaceuticals. And you can just see something which is a global decision, which we may think is far away from us, can actually have ripple effects into into our treatment pathways, into the decisions we have to make at hospital levels, because eventually it is going to impact that as well. The tension between innovation and access, global interdependence that we have been talking about for a very long time, globalization, and now talks much more about domestic resilience, nationalism, which have come up. It's no longer talks which are theoretical. This is very, very real now, and this is what we are seeing unfolding and very, very urgent. And amongst all of this, we are seeing few trends coming out quite strongly. I would say probably 4 intertwined trends which are coming out from all of this. Firstly, geoeconomic fragmentation. As we talk about economic sovereignty, health is coming forth as a strategic priority. It is a priority for the governments when we talk about it. Secondly, industrial policy rebalancing. When we talk about industrial policy, of course, there is more talk about local manufacturing, local innovation being supported much more. Thirdly, if we talk about AI, I think that's, again, another term I'm sure all of you have heard quite a lot about, but rapid AI, digital innovation. These are not just clinical tools, they are levers of resilience nowadays. And lastly, I would also say, and I know one of the speakers earlier also talked about it, sustainability. And when I say sustainability, it's much broader because health systems do demand that affordability, long-term impact, and outcomes are provided much more now than ever. And that also brings me to the next point, which is when we talk about healthcare transformation, what is important today, and I think highlighted much more by the theme of today's session also, is cross-sector partnerships coming together as an ecosystem. When we talk about partnerships, it's regulators, payers, providers, industry, all coming together and co-creating these solutions which are there. And some of the points around interoperability, data confidence, shared governance, they are no longer things which are good to have. These are the basic foundations for these partnerships to actually go ahead. And our role also as APAC Med is actually to bridge so that this innovation is able to translate into access, which is at the core of what we also do. Next, if we move to a little bit deeper into one of the topics I talked about is AI and digital transformation as well. Of course, we talk about how AI in not only in healthcare, but it is the future, right? It is going to define the future. Particularly in our industry, we talk about robotics, we talk about workflow optimization, we talk about diagnostics. A lot of developments are happening around it. But one point which is very important, that the adoption depends a lot on trust. So trust between the clinicians, regulators, and the patients, they have to feel confident about some of these situations, some of these solutions which are coming about. And trust is built through various pathways. When we talk about clear validation, when we talk about local capability, when we talk about transparent governance, and even when we talk about regulatory pathways, which are very risk proportionate, because the risk factor can vary for all of them. And one important thing is also that we need to also look at innovation beyond just innovation, because one way in which we work on this is identifying use cases of AI which add value and those which can actually be translated clinically, which is very, very important also. Ethical deployment of AI, again, remains at the forefront in whatever which we do. AI must be something which is explainable, it should be something which is fair, it is secure, and it also helps to fulfill the system needs, because at the end of the day, that's what we are trying to do, fulfill health system needs. And of course, I think all of you may have also heard about some of the discussions, particularly in healthcare, around human oversight in AI, which is again something which is something to consider when we are talking about some of these solutions as well. However, I would also say that APAC, or Asia Pacific as a region, has a very unique advantage in this. We can actually be a global innovation hub, not just a market, as we heard earlier as well. By combining the regulatory trust, the local capability which we have, and the ethical safeguards, if we go around that path, we can lead in safe, responsible AI for healthcare in the future as well. That brings me to the next point, which I heard earlier as well, which is on value-based healthcare. Now, value-based healthcare, when we talk about health systems, it is a friend of health systems in some ways. It allows you to do more with less, and it rewards outcome. And we have seen a lot of momentum around this in the region. Closer home in Singapore, of course, we look at outcome-linked subsidies, which are there where clinical and economic value is considered. In markets such as South Korea, there's premium coverage, which is there for some of the more high-impact technologies. We see Japan moving more towards real-world outcomes being considered. In a market like China also, they are looking more at diagnostics-related group reimbursement, where performance would be linked to hospital funding. This is a pathway which can actually help us to align financial sustainability with innovation access, which is what we have been talking about as well. Next, if we look at the topic of localization, I would say this is more than just talking about procurement, which sometimes is what it is for our industry. This is something on strategic resilience. And every market would look at the pathway of developing the domestic resilience. ASEAN, of course, in all these conversations is emerging as a diversification hub when we talk about supply chain diversification as well. But it is important, particularly for the healthcare industry, that this is tied to quality, safety, and the value of care which is being provided. If there are harmonized risk-based frameworks across the region, they actually help companies to scale the innovations regionally as well. So that would be something which is very, very important when we talk about developing things at a local level as well. And our goal eventually is to have resilient supply chains that can ensure that there is timely access to innovation across the borders as well. Next, if we look at innovation, I think this slide is quite self-explanatory, but what is important, again, coming to the point I was making earlier on innovation, is that we do not want it to create a two-tier access, that there are high-tech innovations or high cost which are leaving some patients behind. There can be various pillars which can be used. I heard a lot of talk earlier also about preventive care. And a lot of economies in the region, of course, are focusing a lot on preventive care as well. Closer home in Singapore, we have a Healthier SG program. Many other markets in the region are having free medical checkups, for example, in Indonesia, where there was a recent rollout. So this is definitely something which is in the forefront. And you do see the long-term benefits of kind of investing in preventive care as well. But what is also important is eventually equitable access. Equity, as they say, is the true measure of system success. So in order for that to happen, there are some measures which can be around, again, going back to value-based healthcare, but around procurement, around reimbursements, where they are linked to value rather than just a geography, where they are linked to factors up beyond cost, which are in some ways leading to long-term benefits for the patients as well. So I think those factors around outcome, around performance linked, are the ones which will really help us to move in that direction as well. If we zoom out a bit and look at some of the macro forces, I think these are some things which I've already discussed. But again, when we talk about geopolitics, then we talk about decoupling. This can have a big impact on some of the data and technology regulations as well, because again, some of the countries are reassessing what their dependencies are. Industrial policy, again, which I have talked about. But what is also important here is to understand the concept of regulatory harmonization. A lot of these regulations across the region, when we talk about it, they are very variable, whether we talk about AI, cybersecurity, software as a medical device, standards. Harmonization is something which will really help to scale some of the innovation and make sure it reaches the patients. And of course, environmental and ethical considerations also remain central. But it is alignment amongst all these factors which will really help us in reducing the inefficiency and actually inequity, which eventually will help us in building stronger healthcare systems. If we look at some of the risks which come out of it, again, I think self-explanatory, but I'll only highlight that we have seen cost increases already happening. There will be a trickle-down effect of the tariff also in terms of cost escalation on the patients as well. Fragile supply chains, supply chain diversification, and of course, some of these fragmented pathways which I was talking about, and regulatory capacity getting impacted, this also slows down innovation. Patients are not able to get innovation as fast as they would, as it would be ideal. And ultimately, every risk would, of course, impact the industry, but also have an impact on patient, who is at the center of everything which we are doing. Just to call out, just to get ahead of these risks, at APAC Med next year, we are also organizing a MedTech Supply Chain Summit. So anybody who's interested, this would be where we would be talking about all these topics which I've been talking about around supply chain diversification, getting all the players together, and looking at what a resilient and future-ready supply chain actually looks like. Coming back to the point on opportunities, we talked about risks, but also there is always a bright side to everything. There are also some opportunities. And when we are talking about ecosystem collaboration, of course, there are opportunities for collaboration and innovation as well. When we talk about some of the risks around fragmented frameworks, there is a space for aligning them as well. There's a space for working together on value-based healthcare, outcome-based procurement models, some harmonization of data governance across the borders. And one key point here is also on talent. So when we talk about talent nowadays, it's a unique combination of what would work now. It's not just somebody who has a technical aspect, but also somebody who is able to understand and aware of the policy changes which are happening. So it's being named as dual talent, which is the need now. And it's future-proofing the ecosystem will also require that even the regional capability building of the leaders who are able to talk about and understand better what these value models actually are, what are the geopolitical risks which are actually associated, and also understand things around data stewardship. So it's a combination of everything that we are looking at as well. And just to talk about this bilingual talent as well, we're also planning to have a discussion next year around a talent summit, which will be addressing some of these as well. Lastly, what I would say is, that the global health architecture is actually being rewritten, and Asia Pacific does have a unique advantage in shaping in which direction this actually goes. This event, again today, reminds us that innovation alone is not enough. To truly transform health, we must move beyond isolated pilots or siloed innovations to system-wide adoption and sustainable delivery. If we choose collaboration over fragmentation, value over volume, and trust-driven technology over technology for its own sake, then we don't just adapt to change, but we actually set the pace for it. And the world is watching how the region will actually respond, because we can show how the different players within the ecosystem can actually come together and build this together. I would end by saying, let's design the future we want, a health ecosystem that is innovative, resilient, and ready for the world that's coming. I look forward to partnerships that begin in this room today as well. Thank you so much.
Thank you, Bernice. Yep, so we have moved from Singapore to regional, and now the last but not least keynote speaker will be moving us to global perspective. So I apologize that we have to eat into 15 minutes of a lunchtime, if you don't mind, but I believe the content itself will warrant that additional 15 minutes of the lunchtime. So let me welcome Michael Dowding, just landed from Korea yesterday night. Right, he's the co-founder and chief innovation officer of Health on Cloud, and also dual role, Secretary General of Smart Hospital Alliance, which I'm sure he will tell us what are these two organizations, and he's going to talk about transforming global healthcare through collaboration. Welcome, Mike. There's a clicker.
Hi, everyone. Thank you for having us today. It's a pleasure to be here. I'm a little under the weather, so bear with me as I go through. So the Smart Hospital Alliance. The founder of our company is Dr. Sang-Hoon John. He's the president of the Colombian Thoracic Society, Cardiac and Thoracic Society, but he's also the former CEO of Seoul National University Bundong Hospital. So when he started tech, I was the first employee, and this is going back to maybe 2017. It's been a while. But one of the biggest obstacles was hospitals. So can anybody here name the top 3 hospitals in Mexico? Colombia? About UK? About US? Probably. Point is, hospitals don't talk. They don't share. You have a lot of amazing hospitals with a lot of passionate people that are creating POCs that don't get out. Everybody's creating the same POC. Everyone's trying to focus on something that works, but you're wasting time. What is the ultimate goal, right? Is it ego? Is it recognition? Or is it to help patients? This is why the Smart Hospital Alliance started. It was to kind of break down some walls and really have people talking, okay? So expand access, obviously, connecting hospitals. I want everybody to talk and everybody to get to know each other. Education. Education's a big hurdle. You take it for granted here. Singapore has an amazing education. You have an amazing system. You have a lot, like, doctors get funding to enhance their CME credits. Going to Colombia, they don't. You have doctors, you have nurses that are making $400 a month, barely getting by, and there's strikes with the government that cut off funding. But are they passionate? Oh yeah. Will they give you all they can? Definitely. You won't get that in some emerging countries, developed countries, because they make a lot of money, they're happy with what they're doing, and usually there's about 5% that are really driven. We're trying to hone in on that 5% and really connect them and have things going. So right now, the Smart Hospital Alliance actually started around 2020 because a lot of political connections, I'm not gonna lie, and a lot of things we were doing. But ultimately, the goal was to get a really good, solid foundation. So we have the MFT Trust. It's about 12 hospitals in all of Manchester, great hospitals. Asan Medical Center, one of the best in the world in Korea. Seoul National Bunang Hospital, Child Hospital Group. I just signed in Pecan International University Hospital just before I came in. Tec de Monterrey, the largest in Mexico. Top 4 hospitals in Colombia, and I just signed a pediatric alliance with the president of the Colombian Hospital Association. LA Children's Hospital. NUHS is also part of this group. But is it fully functioning where I want it to be yet? No. The hardest part was getting all these people to agree to collaborate and try to get the things going. So right now, as I mentioned, about 20 hospitals. They all starting to know each other's names. But it's also a lot of work. It's a ton of Zooms. I have no life. I get up in the morning, ask Jim. I have a Zoom, and I probably have a Zoom at night, and I'm all over the place. It's really hard to get things going, right? And actually, we're trying the best we can, but we found out a couple of things that help us along the way. So backed by IDB, which is the Inter-American Development Bank. It's equivalent to the Asian Development Bank. About 3 years ago, I started working with them and support from the Korean private sector. And the idea was a feasibility study. Could basically teleconsultings from NUHS and primarily in Seoul, at Seoul National Bunang Hospital, could they consult doctors in Colombia? So we partnered with the top 3 hospitals in Colombia, Hospital San Ignacio, Val de Lily, and Santa Fe de Bogota, and we went into the rural areas. We went into the Amazon, a little clinic in Leticia. Purpose was not to treat the patients. It was to share second opinion and education to the doctors. Long story short, we designed a telehealth platform with the Light EMR, and it was very successful, but it was a lot of work. Just trying to coordinate doctors' schedules, set up the different things, the technology aspect, but it was really, really successful. And IDB were very happy with it, actually. And the turnouts have been great. We also developed a midwife program for teaching in the rural areas of the Choco region of Colombia, where basically I work to develop tech, I work with the public health groups, we made content, we brought it in, it delivered, it was hugely successful. We also developed an online program, ECMO. I worked with LA Children's Hospital, Within Shaw in the UK, Korea University, and here at NUHS. And we developed an online ECMO program to bring it in there because a lot of people were afraid to use an ECMO device because they weren't trained enough into it. Now, when we first started that conversation, nobody would admit that ego really comes into play, okay? When you're dealing with hospitals, I can honestly say this, because when people graduate, they're the pride of their family, right? They're the doctor. They reach the top. Nobody wants to be told what to do. No one wants to say that someone else is better than the other. So there's a lot of breaking this down. Anyways, the course worked very successful. And now we're in the process of bringing all the LA Children's Hospital's courses online and talking with others to basically develop the ecosystem. So I just actually explained all of these, the international case consultations. A lot of people appreciate the second opinion. And right now we're getting ready to trial using AI. So basically AI is to go in these rural communities, and it's not to actually treat. It's to bring awareness so that patients in these rural communities can get redirected in time. In Colombia, I'll give you an example. The president of the Colombian Hospital Association, Dorsa Tassi Rodriguez, she's also the director of the largest children's hospital. In Colombia, kids with that suffer from oncology or cancer, survival rate as a whole national is about 51%. At her hospital is about 70, but in comparison, at LA Children's Hospital, it's 90% survival rate. Now, why is that? A lot of it's because of education, but also it's because she supports all these rural communities where they don't have access to a lot of infrastructure. So people come too late. It's too dangerous to travel. It's a very long trek. People can't leave their families. So we're actually testing and about to start a second round of our IDB in Mexico and Colombia, where we want to introduce AI as basically an alert system. This is not good. Get to a central hospital. Try to speed up. And again, the courses, we're doing a lot more, and then the simulation. Okay, but as I told you, a lot of this presented a problem. It's a lot of work at designing different tech, trying to reach other partners, trying to do Zooms, decentralized. It's tough. So what we started working on, and this is not a product push, but kinda, is kind of like a LinkedIn meets Facebook meets course resource hub to share. I am not trying to make everything. I tried it, doesn't work, it's too expensive, it's really difficult. A lot of people want help. So we're trying to break down the walls based on the knowledge we know, and basically have a shared ecosystem where doctors can connect, AI applications connect, and people can actually kind of work together. Right now, if you can create 5 amazing applications, will it ever get to Mexico? Probably not. I can probably help you do that. And that's kind of what we're trying to do. We're working with 6 Korean startups right now. We also got approval from the Mexico government to develop a nice cloud-based backend to support AI for distribution, so that instead of building things, they might be able to localize, culturalize, and test solutions that are already existing and bring them to market. And again, I pretty much spoke on this stuff. And again, Mexico. I just signed the Mexico contract on Friday, which is really exciting, but it's all about collaboration. I'm not trying to make stuff. I want to bring the best companies I can and bring them over and get them to the people that need it. Let's take Starbucks. I always give this example. You can go to LA, it's like $8 US for Starbucks. You go to Philippines, it's $1.50, right? So how does that work? They price accordingly. They work together. They try to find solutions to bring the best and bring it in. I think we can do that with tech. Again, this is some of the hospitals and the main institutions we're working on. But our main model is collaboration. Just like APAC Med, I'm all about collaboration, because without collaboration, you're not going to go far, right? I mean, to get in a hospital is hard enough. Unless a really large pharma or medical device company buys you with big resources, as a startup, it's really tough to spread outside of your community. We really want to change that. So it starts at the system level. You need to get hospitals on board, because they're the ones that will actually get it covered, will actually use it and adopt it. You have to empower medical professionals. No doctor wants you to tell them what to do. If you can get them involved and help them localize it, empower them, they'll be your champion. They'll make sure it goes in that area. Without them, good luck. Enabling sustainability and growth. We're also working on models where I don't want doctors and clinics to pay. What we're hoping is that we can connect enough people so that pharma and medical device will market their devices to a very big avenue of people. These are kind of sustainable models. We can get healthcare at various costs so people can afford to do it. And you do profit sharing models. It's not going to happen for free. It's not going to happen with grants. It needs sustainability. We're also trying to work on some of those aspects as well. So I'll end on this slide. Accelerate innovation, improve patient outcomes. Most important thing is the patients. You got to let your ego go. When you're dealing with a lot of hospitals and doctors, ego has been the biggest thing I've had to overcome, to be honest, because every hospital wants to be the biggest and best in the world, and everybody has this and that. But at the end of the day, if you really care about the patients, collaboration will break it down. And then accessibility. Everyone's entitled to good healthcare. We should keep it above 90 and not drop it down to 50, right? We neglect it. We have the technology. We can make it work, but it requires collaboration. Thank you.
Thank you, Mike. Please stay on stage. Please stay on stage. Yeah. May I welcome all the speakers on stage as well? We'll take a group photo. Eric, Wei Yang, Anish, Chen Hui. Okay. So I'm sure you enjoy a lot from their talk, and it's never enough. So feel free to catch up with them during lunchtime, right? A round of applause again to all the speakers this morning. Okay, thank you. Thank you, speakers. Yeah, please. Okay, so now we finished the morning segment for today, right? So now it's 12:30, just nice. We'll have 1 hour for lunch, right? Let's come back at about 1:30 for the 3-panel discussion and the closing. The lunch is on the right side, right, of this hall, and then feel free to do it. And then we have a reminder again, we have Innovation Zone, 3 sections, 2 in this room, Gene Solution from Vietnam, Health on Cloud, Smart Hospital Alliance from Korea. Over there is SingHealth, Singapore ETH Center, AWS, Zebra, Microsoft, and EXA. And on the left-hand side, the lounge area, you have 9 companies from NUS School of Medicine. So feel free to mingle around and have a great lunch. Thank you.